So we're going to do some internal and external structures of the heart. We'll start with the main chambers of the heart. So this is the right atrium of the heart. Here's the right ventricle of the heart. Left atrium of the heart. And left ventricle. From the outside, we can see a lot of the major vessels. So we'll start with superior vena cava here. That's feeding into the right atrium. So feeding into the superior vena cava are these two vessels. So this would be the left brachiocephalic vein and the right brachiocephalic vein. This main vessel right here is the ascending aorta. The ascending aorta becomes the aortic arch, and then eventually it would become the descending thoracic aorta that would go down behind the heart and pass down to the abdominal cavity. The three branches off the aortic arch, we have brachiocephalic artery, left common carotid artery, left subclavian artery. Coming out of the right ventricle, we have the pulmonary trunk, and the pulmonary trunk branches into the pulmonary arteries. So this would be the left pulmonary arteries, and this one right here would be the right pulmonary artery. And then it would eventually branch to the lobes of the lungs. Coming back from the lungs, and what you'll notice about these pulmonary arteries is that they're colored blue because they have less oxygen. Once you get to the lungs, you get oxygen, so when you come back to the heart, you have these vessels here, and these vessels on this side. And so these are left pulmonary veins, these are right pulmonary veins, and they're colored red because they're highly oxygenated, bringing oxygenated blood back to the left atrium. Back to the anterior view here, the coronary vessels, you can see coming off the aorta, we have the right coronary artery. Coming off this way and eventually running underneath the pulmonary trunk, you'd have the left coronary artery. Can't see it because this is blocking it, but left coronary artery. The left coronary artery branches into the circumflex artery, so that's going to go around this way, circumflex, and anterior interventricular artery. The right coronary artery is going to come this way, and it has a main arterial branch called the marginal artery. That's this one seen here, marginal artery. And on the back of the heart, it has this main branch right here, which is the posterior interventricular artery. As far as the veins are concerned, we have the small cardiac vein. You can see this small one right here. So it started right here, small cardiac vein. We have the great cardiac vein, so it's starting actually from the front, great cardiac vein. It's coming around this way. And then you have the middle cardiac vein right here. And notice all these veins feed into this structure right here, which is called the coronary sinus. And the coronary sinus opens into the right atrium, just like the superior vena cava does, and this one here, the inferior vena cava. As we look inside the heart, so we'll start by looking inside the right atrium. We have the openings for the vena cavas, so here and down here. We have the opening for the coronary sinus. And then we have this flat structure here. This is the interatrial septum, so it separates the right atrium from the left atrium. And you'll notice this indentation right here. This is called the fossa ovalis. The fossa ovalis is where we used to have a hole between the right atrium and the left atrium when we were fetuses. And so blood could flow from the right side over to the left side. So fossa ovalis is the leftover foramen ovale as a fetal structure. If you want to pass from the right atrium down into the right ventricle, you have to pass through this valve seen here, if you look inside here, and this valve would be called the tricuspid valve. So we're going to open up the ventricles. So again, here we see the tricuspid valve. Attached to the tricuspid valve are stringy structures here. These would be referred to as the chordae tendineae. And the chordae tendineae are tied to ridges of musculature that extend upwards called the papillary muscle. So there's papillary muscle for the chordae tendineae. And then the rest of the muscle inside the ventricle is called trabeculae carni. So trabeculae carni and papillary muscle. Flowing out of the right ventricle is this valve right here. So blood flows this direction into the pulmonary trunk. So this is the pulmonary semilunar valve. Separating the two ventricles is this large septum here. This is the interventricular septum, separating the right ventricle from the left ventricle. Over on the left ventricular side, we have the bicuspid valve. Again, we see papillary muscle and trabeculae carni in the walls. So bicuspid, chordae tendineae, papillary muscle, trabeculae carni. And then we see the valve leading up to the aorta. This is the aortic semilunar valve, and blood passes through that as it goes up into the ascending aorta. One last structure, this thing right here. This is called the ligamentum arteriosum. The ligamentum arteriosum is a leftover structure. Again, we used to have a fetal structure that when as a fetus blood would come into the pulmonary trunk, it would bypass the lungs and go into the aortic arch because you're not using your lungs for breathing as a fetus. So the blood would bypass through this vessel, and that would be called the ductus arteriosus in the fetus. But then as an adult, it closes off, so it's the ligamentum arteriosum.